dentistry is taught at the university level to be about teeth. So you learn tooth forms, tooth structures, bites. You're not learning growth and development. Unless you're going into orthodontia, you're not really learning facial forms and things like that. I mean, that's really an orthodontic teaching that is an extra specialty of 3 years where they're really digging into how the face forms, the growth and development that you go through phases of life, and how the teeth interact with that. But when you're restoring someone's smile, you have to be thinking and knowing those things in order to properly create a smile that functions, because that is very important, but also integrates. And different facial types will warrant different smile arrangements. And it'll also, in many times, there are nuances to different ethnicities in actual tooth form. Like, not everyone's teeth, not everyone's central incisor is really the same. In fact, generally, you can see the difference between an Asian and a Caucasian front tooth. They're different shapes. And so when you're designing smiles and you're looking at all of these kind of inputs, you have to have a catalog in your brain to really pull from, to say, okay, I'm taking this face that when they were at this age, they had these things happen to them, and now they're at this stage in their life, and I am going to perform and plug and play, or put in teeth that fit into this person's face. So what does it really mean? If we look at these different faces, they all have one thing in common, in that they're squarer faces that don't show a lot of their top teeth, right? So it's a very square jaw, wide cheeks. Typically, you will see in patients like this, they have strong masseter muscles. They're typically clenching a lot. They have wide smiles, and their biggest smiles show the top of their gum. So they're never going to be a toothy smile. In fact, over time, as you get older, your upper lip will drop. And most of the time, as your upper lip drops, it's covering the teeth, and it's harder to show teeth at a smile. So these patients typically walk in, they say, I lost my smile over time. And so we know that one of two things has to happen. As soon as I see a face like this, the quickest fix and easiest option to get them to show teeth is just to build them out and make them longer. Now, it also goes into a direction of color, because these patients' teeth need to have more density in the color. It's not, if these patients come in and they say, oh, I want really translucent teeth, I would start to have the conversation with them saying that translucency is not good for you, because what we're trying to do is get teeth to show in the picture of the face. And so translucency means light's passing through, and what we want is density, to push a little color into the facial form so that you're showing some teeth. We want reflection, which is density. So as time goes on, you show less and less teeth. And also, if you're doing anything dermatologically where you're putting fillers in, especially the lips or in the nasolabial folds or things like that, it's going to create further weight and push the lip down. So it's going to be harder if you look in a case like this, where you really have to not only just build the teeth out and longer. In cases like this, you probably have to do all of the bottom teeth to make them taller, and do something called opening the bite. So in square jaws like this, the masseter is so strong that you tend to be a really heavy clencher. And as you're clenching, you're actually intruding the teeth, and you're taking this dimension, the lower third of your face, which is supported by your teeth, and it's compressing over time because you're intruding the teeth. So as that happens, what we want to do to get teeth to show is make them out and longer. But you can't do that if the bite has been compressed, because if you make them longer and you go to bite into something, you're going to break your teeth. So what you do in a case like this is you actually open the bite back up or restore it, and then you have room to make the teeth longer and out more so they'll actually show in a smile. Here is a kind of mixed bag of different face types, but again, each one has to be planned for. So here you have kind of the same square face where you're putting a lot of compression on the teeth, but like a face like this, for instance, is the opposite. It's longer and narrower. And these are the cases where we're automatically thinking about doing crown lengthening, which we spoke about earlier. Crown lengthening because the lower jaw grows down further than the average, and the upper jaw grows down to meet it, takes with it the gum and the bone, and you show everything when you smile. So in a case like this, we may do crown lengthening, so we know, if I'm looking at a patient like this, I'm automatically thinking I may need a periodontist involved in this case. I'm also automatically thinking that this is a case where we need a lot of transitional color and translucency, right? So it can't be dense and white because when they smile, they show all their teeth. Everything shows in a smile all the way past the gum. And so you not only need translucency to not overpower the smile, but you also need transitional color from the gum to the tooth. So if a patient comes in and they show all their teeth and it looks really white, or they say they want really white teeth, that's going to be a part of a conversation that I'm going to have with the patient to explain to them that the transition from the gum to the veneer has to have some warmth in it so it doesn't go pink to white, or else it's going to look fake. And then ethnicity plays into it as well. And so you have to be thinking about that, because if you look at a jaw like this versus a jaw like this versus a jaw like this, they're all very different and all have different complications to them. But the point is that you cannot treatment plan one smile or one, we're taught in dental school smile design, which is basically a formula to create teeth for human beings. And my point is, and this is, when I wrote a paper on facial aesthetics back in 2007, it was looking at all these things and saying, how do different teeth work with different ethnicities, work with different facial types, different age of patients coming in, and what are all the nuances that need to happen in order to integrate those teeth into someone's face? And when somebody asks, why are you different? That is something that we have always practiced here. It takes our aesthetic dentistry to a different dimension and gives people an added touch to make it truly disappear in someone's face.